If you're considering breast reduction, you have three options for treatment: natural, medical, and surgical. In this video, I'll guide you through each of these approaches. What are the reasons for getting breast reduction? There are several reasons why patients ask for breast reduction. Most common is physical symptoms. It could be back pain, neck pain, heaviness of the breast, which can affect posture and some activities. Another reason for breast reduction is for aesthetic purposes. So sometimes the size of the breast can be out of proportion to the rest of the body in terms of aesthetics, and people, they want it to be more in proportion, so they ask for it to be reduced. And lastly, we sometimes do full breast reduction or even mastectomies as part of gender affirmation surgery in those patients who transition their gender from female to male. What are the natural methods for to achieve breast reduction? First is a healthy diet and exercise that helps to reduce the weight. And as we know, part of the breast is made up of fat tissue. So anything that will help to reduce the weight and reduce the content of the fat tissue in the breast eventually results in a reduction of the breast size. Another way to alleviate the symptoms which are related to the breast size or volume is achieving good support of the breast tissue. That's involving good and well-fitted bra, a good quality sports bra, as well as clothes that will fit better around relatively larger breasts. What are the medical treatments for breast reduction? There's no direct medication or treatment which we tend to prescribe to actively reduce the breast tissue. However, if we find out that the enlargement of the breast is caused by underlying hormonal problem or underlying medical problems, what we tend to do is treat the underlying hormonal problems to start with. What are the surgical options for breast reduction? Generally speaking, there are two methods to achieve breast reduction. There's the traditional way. The benefit of this, you can remove as much as you like of the breast tissue. You can go as small as you want. But the downside is tends to leave behind quite extensive scar around the areola and underneath the breast. Nowadays, another method which become more popular is using the liposuction to reduce some of the volume of the breast. So this relies on using a liposuction cannula, which is a hollow cannula connected to a suction machine to remove the fatty part of the breast tissue. Obviously, that has limitation of it can only reduce the fatty tissue in the breast, doesn't get rid of the gland. So might be a limit of how small the breast can be. The benefit of liposuction is less invasive, tends to leave less scar in the breast, and the downtime is less than the traditional breast reduction. So which breast reduction method is right for you? If you want to avoid surgery and choose a least invasive option, then the natural way to reduce the breast might be the safest and easier way to achieve some breast reduction, and that's by weight loss, exercise, aiming to reduce the volume of the fat tissue in the breast. And once you achieved your target weight and you tried that natural route first, if this doesn't achieve your aims and you still have relatively large breasts, then you could look into the surgical options. And these could be liposuction, or it could be the traditional excisional surgery. And that also relies on two things. First is how much reduction we want to achieve, and also how much fat tissue there is in the breast. So if most of the breast is composed of fat tissue, then liposuction might be a reasonable way to reduce that volume. But if the majority of the breast tissue is made up of glandular tissue, then the only way to reduce it would become surgery.